You heard about the reports from China, and they heard about some kind of disease there, and it really didn't mean anything, and now it's starting to obviously pick up speed.
I myself, I think I underestimated the power of this virus, and it's going to devastate. It's going to be bigger than World War II. It'll be way bigger than 9/11.
There are more patients coming in, and most recently, they're coming in sicker.
The whole thing was a blur. It's like it's living a nightmare.
The emergency department is there to help those in need, but we can't do it for the volume that's coming out of a fire hose.
We're going to try to save as many people as we can, but as the virus spreads, there is going to be a limitation in resources, and the medical community is going to have to make some challenging decisions.
You can't even think about the future. Like, I have to do tomorrow, and then we'll go for another tomorrow after that. We're seeing people my age die.
It is always hard to see somebody younger than you die, but that's the job, right? You get up the next day, you have to come back and still be able to do everything you can for the other set of patients too.
COVID has introduced us to a world that we've never encountered before.
It's going to get worse before it gets better.
It's going to change our lives forever.
And the two students we spoke with tonight had spent the last 3 weeks in Beijing, and both told us they were struck by how quickly things escalated with the coronavirus.
And overnight, more than 600 new cases were reported around the world, bringing the total to more than 83,000. There are no confirmed cases in the DMV.
It's been a little busy here lately.
It's been a 24/7 since we started really about the 10th of January when we thought this might be important.
Tell me why we're not wearing masks and gloves.
We never touch an human infectious virus.
So we made 3 different vaccines, and we need to know which one is the best out of 3.
This is the time for facts and not fear.
Do we have this epidemic here in DC? That's the question we're trying to answer.
We are wearing civilian clothes, if you will, no masks, no gloves, no gowns. What is the reason for that while we're standing in this lab?
These are not real samples because we don't actually have any real samples in.
Yeah, Jonathan, confirmed just a short time ago by the governor and top health officials, a married couple in their 70s and a woman in her 50s contracted COVID-19, the coronavirus.
And we just learned of another death in California, bringing the U.S. total to at least 13.
It was only a matter of time for a case to be identified in Loudoun County.
The coronavirus is beginning to turn the sports world upside down. Cancellations and postponements of thousands of sporting events. It's happening all across the country.
I had a number of students ask me about the prom. Is the prom still on?
That's a good question. Is it still on?
We don't know. It's just too early to tell.
It wasn't part of my plan to be the person that brought the coronavirus to Washington, D.C., but that's the way it seems to turn out.
We're curious, what do you think it's going to look like for people? What will the routine behavior be for people 3, 6, 9 months from now?
Yeah, I think for a while there's going to be clearly some attention to physical separation, but not to the extent where it's as disruptive of the normal social and business type interactions.
It's one of the sad things, tragic things about this whole COVID thing is people dying alone.
A couple of weeks ago, I started taking it because I think it's good. I've heard a lot of good stories.
President Trump claiming he is taking hydroxychloroquine despite testing negative for coronavirus. Federal health officials are warning against taking this controversial drug, which hasn't been proven to help in the fight against COVID-19.
If you're in line with your ticket, please hold it up so we can see it.
The moving tribute, more than 260,000 white flags dotting the grass near RFK Stadium in the district, each representing a life lost in the coronavirus pandemic.
But to see that many flags, maybe then people will realize the extent, the true immensity of this pandemic's loss.
It is a small step closer to normalcy, but one Northern Virginia doctor says now is not the time to let your guard down.
It's the unknown that's really scary because there's so much we don't know. Like, every day it seems to be affecting the patients differently, and they're just getting sicker and sicker much faster than kind of anything we've seen.
These patients are so sick, but we still provide full nursing care to them, just like we would any other patient that is not COVID positive.
This was like ground zero for
There's
the
a lot of the firsts happened here.
I've been a nurse since 1981, and going through this COVID pandemic has never made me more proud to be a nurse, and really helps me realize why I went into this profession.
And it's why I do it now, even literally putting my own life on the line.
I don't know if you noticed our big banner on the wall outside of the hospital. It says, "Heroes work here," because it's true. They are absolutely heroes. They do their job and go above and beyond what they need to do every single day.
I gotta face it, we were close to death. If I would have to name this situation, I would say coming out of from the gates of death.
I was maybe debating to God that I don't want to go. I'm the wrong person to take me.
Maybe I wasn't ready to go yet, you know. I didn't want to leave. I have 5 daughters, a wonderful wife, and that's enough for me.
We all fought to be back to here, to be back, you know, with our families, and I think the doctors and the nurses fought for us as well to get us back here.
Hi. I just wanted to check and make sure you're doing okay.
You open your eyes and your family is the nurses, your family is the technicians, your family is the doctors.
We're making some changes every day to try to make this better.
After the pandemic, do you think the collaboration is going to continue?
I think it has no choice but to continue. I think we've learned so much. I'm really grasped the stronger together mentality that through cohesion, through communication, collaboration, we are so much better able to serve the needs of our community.
I think this is a special moment. This is a time where you saw your healthcare system come together and take on the worst disease that we've seen come along in our lifetimes.
Everything we do is for our patients.
You proud of your team?
I am extremely proud of my team. Extremely proud of my team.